This has very, very huge implications. When you look at putting these two data sets together, if I can put together your user-generated kind of always on, always monitoring data about the individual, and I can now pair that information up with your health record, now that gets very interesting from a standpoint of where could you open up a whole new swath of kind of app ecosystem dollars and developers. I am more bullish on the physician. Let's look at Apple. So today is Veterans Day. I want to give a heartfelt thank you for the service to all of our vets, our active military members, and all of our vets for serving the country day in and day out. And today on Veterans Day, well, actually, I guess last week this was announced. Apple announced that the VA, you can now get your Apple Health to sync with the VA, the Veterans Affairs Department, which has over 9 million vets and their family members that go to the VA. The VA is basically, I think it's the largest hospital in the country, for those of you who don't know what it is. And it's a national healthcare provider, and they have locations all over the United States. So now all of those 9 million patients can now have their health records easily accessible through Apple Health. Really interesting, right? And so Apple has this page on their site. This is speaking to the healthcare provider about why they should integrate with Apple Health. Engage your patients in their own health. You can kind of see here, right? Like they can kind of dig into all their different data from the iPhone. Very interesting. Complement your patient portal so you can log into the health records using the same login information as, like in this case, Cedars-Sinai's patient login credentials. Also very interesting. Hundreds of institutions that have already signed up with Apple Health, providers that have signed up with Apple Health. So what they have been less transparent on, and if you remember a few weeks ago, we spoke about Don Rucker from the Department of Health and Human Services, that he was very pro letting Allscripts, the EMR company, share and integrate health records to be shared with Apple Health. Despite the AMA, the American Medical Association, was vehemently against this and said that there is patient and privacy concerns. What happens if your data, your electronic health record, is now in Apple Health? What other third parties can get access to that information? Historically, the way Apple has run this is to say, you as the patient using Apple Health have the ability to provide app by app permission for which apps can get access to your health information and which information in your health record. So it's very specific. It's on a case-by-case basis. But basically, you give that all those capabilities to the patient, and that no third-party app can just willy-nilly get access to your health records. That's the way it's supposed to be. That's the way I'm sure Apple has sold these healthcare providers on the way it will continue to be. But this has very, very huge implications. And we just saw, I think last week also, that Google bought Fitbit or has put in, or is trying to buy Fitbit, put in an offer to buy Fitbit. It hasn't closed or been fully approved yet, but it seems pretty likely like they're going to acquire them. And so that's Google's mechanism to combat the Apple Watch, which is now giving Apple and now Google the patient user-generated data about your health, right? It's really kind of tying that in. And I think when you look at putting these two data sets together, if I can put together your user-generated kind of always on, always monitoring data about the individual, and I can now pair that information up with your health record, now that gets very interesting, because if you talk to a lot of tech startups in the healthcare space, just looking at the health record alone doesn't solve everything that you need. I think a lot of them, some tech startups will poo-poo what comes out of the health record, or that a lot of the information, half the information is correct, half the information is incorrect. What do you look at? Are you looking at the wrong information or the right information? Point is, just having the health record doesn't solve all of your data needs. A lot of it is about kind of putting multiple data sets together and then using AI and machine learning to then draw inferences between those two data sets. Or the more data sets that you can pull in from different places, the better, right? So, and then you can mash all that up and then try and learn what's real or what you should actually be focused on or concerned about. That's where this gets really interesting with the Apple Watch, with the health record. Apple putting its own basically proprietary data on you together with the health record, the standard data, right, that you get in your physical. Google clearly seeing that as a threat and them needing that in their arsenal, buying Fitbit. Now, I think the question is, though, on who pays for all this stuff. So the idea is that you can make apps and you can open up this data to third-party developers, right? I am more bullish on the physician spending money, well, wanting to spend money. How the physician spends the money is a whole other thing. Is it the insurance company, the payer, or the actual physician? But I think how now Apple Health can leverage these two data sets and the fact that the patient can say, yes, I'm okay to sharing this, and then bring that back into the hospital and now enable the physician to say, hey, this is literally what I do every day, right? What apps would I want to use? What apps could be using Apple Health to provide better insights, to provide better software or workflow software for me in my practice, to help clean up the data or the bad data in the health record, for example, and scrub that out, clean it up. I think the physician is going to see a huge amount of really practical, utility-based value coming out of apps and software and new tech startups in the healthcare space, innovating on the data that Apple Health is able to unlock. I think patients will see some of it, but patients aren't experts. And I don't think patients are going to want to spend a huge amount of money. I think some patients will certainly be spending decent money on apps and already are in the health space. But I think from a standpoint of where could you open up a whole new swath of kind of app ecosystem dollars and developers, I think down to the physician that's practicing day in and day out in a hospital and really has been in a vacuum. They've been having to use these old Epic, Cerner, EHR systems that certainly don't meet all their needs. And I think where that ecosystem of app developers is going to be a huge boon to the industry is down to the physician. Doing what Apple's doing on the consumer side is key to that. But this will be really interesting to see how Apple brings us full circle back into the physician. Hi, this is Alex from Winner Take All. Thanks for joining us. Hope you enjoyed the content. Feel free to leave a comment, ask us questions, and definitely make sure to join us on our next live stream.